Shalom, bless you all. This is Sister Gabby here again. And today's video is to breastfeed or not to breastfeed. And what I'm going to be talking about is the supporting of breastfeeding and why our people, African Americans, Hebrews, whatever you identify yourself, a minority, women of color, the importance of the reasoning behind why we need to be breastfeeding and supporting breastfeeding. So I'm going to get started here in a few minutes. I'm going to finish grabbing everything, and bless you guys. Thank you for your patience. Okay, so what I have is I have a couple of demonstration props, and I have a PowerPoint on just not even half of I would like to go over or talk about pertaining to breastfeeding, but I believe the points that I have pulled out to put on here are very important to mention. So, like I said, I will probably do multiple videos of certain topics or certain subjects pertaining to pregnancy, because there's just so much more that I could go into. But, for time's sake, I don't want to have like a 6-hour video. So the PowerPoint is not that long. It's just a couple of slides just to give you some of the key points on why breastfeeding is very beneficial for both mother and baby. And there are some things that are on the that are not on the PowerPoint that I may mention. So just just kind of, I guess, pay attention to what I'm saying. I may say something that's not on the actual slide. So I probably will do another video just to give you more information behind the breastfeeding. And, if anyone has any questions or any concerns, that will bring about another video as well. So I'm going to go ahead and pull up the PowerPoint, and you won't see me until I go through the slides that I have. Once I finish the slides, then I'll actually show you the demonstrations on what we'll talk about on the slides. So let me go ahead and pull the slide up. Hopefully it is beneficial to you guys. I pray that it is helpful and that you are able to learn from this video. There's so many different things out to learn about breastfeeding, but I was really encouraged to do this video because I just know for myself, being classified or identified as an African American, our women in general, we have the poorest rates in breastfeeding, the poorest rates in initiation of breastfeeding, and the poorest rates of continuing to breastfeed throughout the toddler years of our children. And it has devastating effects on not only our health, but on the health of our children. And so I was just more moved to make this video just to show the importance behind why our women, minority women in general, need to really pay attention to breastfeeding, actually do some research on breastfeeding, and see the dramatic benefits there are for you as well as your child. It's so much of an impact on the health of your child from infancy all the way up to their adult life. And so these videos that I do will just continue to go into how important it really is for us to grab a hold of using our bodies the way they were designed to be used, not suppressing breastfeeding, not suppressing the milk, the natural response that your body makes when a baby is born, but actually grabbing a hold of that and, harnessing that natural ability. That's just amazing to me, for you to not have to go and try to figure out how to feed your child. Your body was already designed perfectly to give the baby everything that it needs in your body. So, that's how this video came about. And I hope this is helpful to you guys. I hope this gives you a little bit more understanding. And I hope it brings encouragement to you as well, to, even if you just person for those initial couple of weeks or a couple of days, even that right there is beneficial to your child. So this PowerPoint, and we'll just start from there. Okay, so now you guys should be able to see the slide. And if you can't see the slide, just let me know. What is this going on here? All right, so it says to breastfeed or not to breastfeed. Of course, I'm in support of breastfeeding. Mother's herbal instincts be herbally defined. Okay. So what's the deal with my breast? Well, your breasts are vital to humanity. And I make that statement because mother's breastfeeding, it benefits humanity as a whole. You're saving money. That's one of the benefits. Because it doesn't cost you anything to feed your child. You are making the environment a better place because you're not purchasing all of these materials, which formula is placed in. You don't have a lot of formula cans. There's less bottles that have to be created. Less plastic that has to be manufactured to make the bottles. You know, your milk is a renewable resource. It's going to continue to secrete and come out as long as you are deciding to nurse. So that's benefiting humanity as a whole. It's also benefiting, women who do work. You are less likely to take off sick days in the near future if you breastfeed your children, because breastfeeding builds the immune system in such a way where the children who normally get sick the most are children who haven't had nursing or breastfeeding as their exclusive method of eating. So it benefits the humanity, benefits society in that manner. So you want to nurture them and protect them. It may sound strange, but society itself benefits greatly from healthy breasts. You want to take care of your breasts. You want to make sure that you're having the proper nutrients, the proper foods going in your system. What I mean by proper foods, I mean real foods, raw foods, not processed foods. McDonald's is not real food. Burger King is not real food. All of these fast food restaurants, these fast food joints, these name brand cereals and, foods that we buy in the stores, that's not real food. Okay. So you want to make sure that you are getting good quality food in your system for your breast to continue to be healthy and produce the right type of milk. Your breasts are a major makeup of who you are as a woman. Own it, no matter how large or small you have. You have the ability to shape and mold the world naturally. So I encourage you to own who you are, what the Father has blessed you with, because it doesn't matter the size of your breast. Your breast has the capability to still produce a healthy child. Okay? Okay, this slide is just showing you the breast anatomy. On your left side, or my left side, you have the anatomy of a lactating breast or a lactating mother, which in other words is a mother who is producing milk. And then on your right side, you have the anatomy of just a regular female breast outside of lactation going on. Okay. I just put this diagram on there so that you can see exactly what the shape of your breasts look like on the inside, what each So you can see what each vessel, what each tissue, you're seeing what each picture in the diagram actually represents. Most of us identify our breast as, okay, just the breast and then the nipple. A lot of women call the areola the nipple, but you don't know that it's called an areola. So this is just giving you the proper wording for each part of the breast. And then showing you the makeup of the breast. A lot of people don't know what the breast is made out of. Most of the breast is made out of adipose tissue, which is called, in our terms, fat tissue. So on both sides, you can kind of see. One side says adipose tissue, and then on the just regular female breast, it says fatty tissue. So the breast is really made up of fat and lobes, the ducts. Okay, the lobes. All right, if you can see those little cluster-looking, kind of purplish clusters on the inside of the breast, and then all the yellow is the fatty tissue or the adipose tissue. It's even on the lactating breast. It even also shows you on the regular breast, like your chest cavity, your chest wall, your ribs, and then the muscle. If you pay attention, it says the nipple is just the pointy part. That pointy small part is your nipple, and the surrounding dark part, if you will look at your breast, you'll see that surrounding circular dark part where it kind of has like little bumps on around it. That is your areola. Okay, that is your areola. That whole part is not the nipple. Just the pointy part is considered the nipple. Okay, you can see the lactiferous ducts, the lactiferous sinus for the lactating mother or the breastfeeding mother. This is what your breast looks like. Okay, you have suspensory ligaments. Those ligaments are the structures that keep the form of your breast. Okay, so even after you're done breastfeeding, it's still considered partly like a muscle. So a lot of people think that breastfeeding is what's going to make their breast sag or make them, frumpy looking and things like that. That's not true. Not all women who breastfeed have saggy breasts. What actually gives saggy breasts is the lack of care for your breast after and during. You treat your breast just like you treat the rest of your body. If you're working out, it's going to pan out great for you. If you're not, it's not going to pan out too great. Things are going to start sagging. Things are going to start looking frumpy. So the good thing about it is you have the ability to change and reshape, bring back what the original state was. Okay. I'm trying to think what else is on here. Okay, so if you look at the lactiferous sinuses and the lactiferous ducts, that is actually where the milk comes through from. Okay, the milk flows through the ducts. That lobe, that little cluster looking thing, that's where the milk forms. The milk forms in there and it holds in there. And once baby latches on, puts his mouth around the areola, those little bumps that are on your areola, if you don't know exactly what that is or understand why you have little bumps on the areola, those little bumps are there. Baby's lips doesn't slip. It's like their form of traction for their lips to stay on there. Okay. It also has other benefits as well. Oh, and I'll probably go into more detail about that on another breastfeeding video. So this one's just kind of surface. But once the baby latches on and the baby begins to suck, the milk comes through those ducts. It comes through the little tubing, and then it comes out through the nipple. Okay. So it's very cool. It's just amazing. I'm amazed every single time with pregnancy because every time you learn something different, you get to see your body just function without you telling it what to do. It just already knows what to do. And I think that's amazing. All right. African American statistics on breastfeeding. I thought this was really sad. But for our initiation rate, African American women, only 58.1% actually try and start off breastfeeding. And I think it should be significantly higher than that. But, I just attribute all of these findings to the lack of education that's really given to us as women, as a minority in general. We really haven't had anybody teach us and show us. And 9 times out of 10, when you're not taught something, or you don't have someone who's available to spend time with you doing hands-on, where you can actually get that, you kind of just don't even think about it. It's just like, oh, well, I'm just going to do the next easiest thing, which formula feeding is not easy at all. I think it's more of a hassle than breastfeeding actually is. Breastfeeding is very easy. You just need someone to help you, and you just need someone to show you. And that's what our community lacks. So I'm hoping that this video is helpful for the minority community. And hopefully it'll just spark an interest to not only initiate breastfeeding, but to continue breastfeeding as long as it takes for the baby to develop a proper immune system. If you look at the statistics on the women who nurse up to 6 months, it's even lower. It's 27.5%. That's for our people. So that means exclusive breastfeeding up to 6 months. Once you get to 6 months, it just continues to dwindle down. And again, I think it's just because of lack of education, lack of support. I remember when I was pregnant with my first son, being in the hospital, right after I had him, this lady walks in and she goes, oh, that, like she was shocked. Oh, that's good that you're choosing to breastfeed. I'm like, yes, ma'am. Doesn't, why is that a shock? And it was a shock to her because she doesn't deal with a lot of African American women, Black women, minority women who actually desire and choose to breastfeed. The room and see that this was a Black woman requesting assistance and making sure that the nurses don't give my son formula. When she walked in the room, she had this look on her face like, oh, okay. And then she was even more shocked to find out that I knew how to manually self-express my milk before her coming in there. She's like, well, do you know how to do this? I said, well, yes, ma'am. I've been reading, and I've been doing worksheets and watching videos. And so I think I do. And, with my first attempt, I expressed milk, and it was just a shock. It was a shock to her. This was a European woman. And, she just kept saying how proud of me that she was. I'm so proud of you, like, for choosing this and, for just being able to do it. And I just, it didn't really bother me then. But now, the more I think about it now, I'm like, this is this stereotypical look that we get. Is they don't expect us to know how to do these things. They don't expect us to choose breastfeeding as an option. It's almost like formula was designed and created for our people purposely. And, that is a problem, and that is an issue for me. And so when I see our women breastfeeding, I get so excited. And I'm just, especially a mom who feels as though she's having a hard time. And I'm like, we need encouragement. And there's not African American lactation consultants. Every lactation consultant that I have actually encountered has been a European woman. And, I want to encourage you, my sisters, um, women of color, to really look into things like that. Look into being a doula, look into being a midwife, look into becoming a lactation consultant, being a woman who will support and help her sister during this whole birth process. There's not many of us out there. And when we get in these types of fields, or when we begin to engage in what's natural, it's already like a stigma that our people don't do this. So it's very rare for them to see us actually participating, actually having success with breastfeeding. You guys can do it. You can do it. There is somebody who is willing to show you and teach you how to nurse your baby. There's somebody who is willing to teach you how to get the baby latched on, how to get the baby, don't feel like you can't do it because they're expecting us not to do it, and it's not anything against them. It's just what's already been ingrained in their mind. That's just the stereotype that's been placed on us. And we have to reverse that. Look at the statistics as far as exclusive nursing, 12 months plus, 12 months after. For our people, that's 13%. That's us included with just America in general, 13%. And it's really shocking. It's really shocking for other nations, other nationalities to see an African American woman nurse longer than 12 months. And I think we should shock the nation. We should shock the world by nursing longer than what they expect us to. So I just really thought it was important to show these statistics because it's alarming. It's alarming. It's very alarming. And I am here to encourage you. If you need help, I will help you. I know, even if I live miles and miles away, I will get on this video and I will keep making videos to show you how to properly get baby latched on, how to calm baby down, whatever. I will help you. I mean, it's as simple as leaving a comment, sending an email. I will help you. Okay? The Father has blessed me with the ability to be able to learn these things, and not only learn it, but be able to apply it. And so a lot of people can learn things, but it's hard for them to apply it. And so because He's blessed me with the ability to be able to apply it, I am dedicated to help as many women, as many sisters, especially minority African American women, on how to use your body in the manner that the Father designed your body to be used, how to make sure that your baby is getting the best benefits that it can possibly get, give you this information that is out here, but it's not really easily accessible by us. I am here to help in that area. Okay? African American mothers are still 2.5 times less likely to breastfeed women. Breastfeeding is beneficial to almost all mothers and infants, but the benefits may be significantly greater for minority women. The reason that the benefits are significantly greater for us is because our women have the highest risks of diabetes. We have the highest risks of obesity. We have the highest risks of all of these issues dealing with cardiovascular health. We have the highest rates dealing with cancers. And so breastfeeding is significantly greater beneficial for us. For those reasons alone, right there. It's a great benefit to your body as a woman. So this is more important for us to nurse our children than any other nationality of people. It's good for every woman. But most importantly, African American women, you need to. You need to. You are. It is more beneficial for you because of the diseases that are backed up against us. Okay? Think about that. Get that in your mind. Do some research. Go check behind everything that I'm saying. Okay? The next slide. Benefits of breastfeeding. All right. Well, it releases hormones in your body that promote mothering behaviors. So for moms, first, especially first-time moms, I remember being a first-time. Well, I was actually pregnant. You know, first-time moms, you're pregnant, you haven't had baby yet, and you have those thoughts that go through your mind, like, "Dang, I don't even know how to be a mom," or "How will I know that I'm supposed to do this?" And "How do I know? How will I know when his cry?" Or the different thoughts and questions like that go through your mind. But guess what? When you breastfeed, the benefits of breastfeeding, your body releases hormones. It releases hormones that promote a mothering instinct in you. So it's like immediately once the baby comes out, it's like once they're attached to you, it's like you already know what to do. That is amazing. That is a benefit that nobody told me about. I had to do some research and look behind this. Like, your mothering instincts kick in quicker. They kick in once baby is attached to you. Because like I said in the previous videos, there is a symbiotic relationship going on between mother and baby, between father and baby. Okay? It is just amazing. The father's amazing. Another thing is it promotes a growing attachment between the two of you. You develop a bond like no other. It's like I can't even explain the type of bond that's developed between the mother and the child from nursing her baby. It's a closeness. It's just like this. It's almost like a spiritual thing going on between you and baby. Every single time you latch the baby on, it's like a connection happens. And are disproportionately affected by adverse health outcomes, which may improve with breastfeeding. So what I was just talking about the diseases being against us, this right here is going off of that. Because of the adverse health outcomes that our women deal with, breastfeeding will improve our chances of not developing those types of diseases or illnesses. The benefits would also be prevents nearly 1,000 deaths among infants each year if 90% of women do breastfeed. Okay, so it has the ability to prevent nearly 1,000 deaths. But that's only if 90%. If 90% of women began to breastfeed. This could be prevented. Like I mentioned earlier, it's better for the environment and it saves money. Because all you have to do is, okay, baby's hungry, your milk is filling up, just roll over if you're asleep, latch baby on, and there. That's it. That's how simple it is. Boom. Just that simple. You don't have to run to the kitchen, warm up water, get the formula out, scoop it out, stir it up. Go buy plastic bottles or anything of that nature. You don't have to do all of that. You just unlatch your nursing bra and latch your baby on, and you're good to go. Cells, hormones, and antibodies that are naturally formulated in breast milk help protect babies from illness. Nursing your baby decreases the rates on developing cancer. You know why? Because your breast milk produces stem cells. It produces T cells, anti-cancer, how do you say that word? Carcinogens. That is amazing to me. That's just amazing. There's so many different things that the breast milk is producing and making that scientifically all of it hasn't even been proven. They're still looking at everything that's in there. They haven't found out everything that's in there. Do you know how vital that is? Here, let me share something, because some of you may not know this. What I just said about cancer, this is so serious and so important that cancer patients are purchasing breast milk. Do you understand how serious that is? That an old person, I don't mean by like elderly or anything like that, but I'm saying someone other than an infant, they are out here trying to find breast milk, purchasing breast milk by the bundles to help with their cancer. So if a cancer patient sees the importance and how vital it is, how nutritious, how breast milk is, now we should see how valuable it is. They're buying breast milk to help them through cancer. Look it up. Look it up. There are women who are just making tons and tons of milk just to sell their milk because it is liquid gold. Like it said, it is liquid gold. It is helping with cancer. I want you guys to go look that up. That's amazing. Disadvantages of not breastfeeding. I only have one. I'm pretty sure there's more. But once you see the benefits, you can kind of see the disadvantage in that. But this is the main disadvantage. Human milk is species specific. Okay? Your milk was designed for your baby. Why give your baby synthetics when his body was not designed to digest it? That is the disadvantage of breastfeeding. The human milk, the milk that your body produces, was specifically designed for your baby. Don't waste it. It's free. It's free. What's the big deal? Formula has the same benefits, right? I beg to differ. Although formula is a substitute for some women, I do not recommend formula. I recommend breast milk, even if it's not your breast milk. Now, some of you may be like, what? You want me to give my baby somebody else's breast milk? Yes, I do it. I told you I am here to help women. I'm here to help your baby. I know that breast milk is more vital than any type of formula you could ever give a baby. And if I can produce milk for your child and my child, I will. That is just me. That is how serious I am about breast milk and how serious I am about the health of babies in general. If I'm producing milk and your baby's hungry and your milk isn't coming in fast enough, or you're having time getting your diet together where your milk is not producing properly, yeah, that's why I can give your baby some milk. I don't see anything wrong with that. If cancer patients are buying milk, I don't see the problem with me nursing someone else's baby. I mean, If you look at our women, African American women through slavery, what do you think that we did? We deprived our babies of our milk to feed the slave master's babies. So it's not anything different. This time you have a choice, and I choose to help whatever mother is in need of breast milk. If I have breast milk to give in that moment, I will give my breast milk. And I think that's the most humane thing to do. I think it's beautiful. Why should somebody else's baby suffer? Why should somebody else's baby starve because their mom can't produce the proper amount of milk or adequate amount of milk, or her milk hasn't come in yet? Surgery, or she's taking medication where she can't feed her baby because the medication is going to get milk stream and could be harmful to the baby. I think about things like this. If I ever got sick, would I be fine with my sister feeding my baby? Yes, because I know she's eating well. She's eating properly. She's not smoking. She's not on any type of drugs. She's doing the same thing that I'm doing because she's my sister and she lives with me. So, and I would do the same thing for her baby, So, I mean, we have to open up our minds and see the benefit of breast milk. I would not give my children formula. I would not give them formula because I know what's in it. It can have vitamin A, vitamin C, vitamin D, vitamin K, vitamin E, B6, B12, B16, all of those. It can have all of those, but guess what? It's synthetic or it's derived from an animal that, no. Mm-mm. So I don't really support, I don't support giving your baby formula. But if that's all you can do, access to, then give it to your baby. But if you have another mother who who is in your community, who is nearby you, and she nurses her baby, open up your mind to seeing about receiving milk from her lifestyle. If you know what she's eating, if you know that she's properly taking care of her baby, then you would be perfectly fine with her nursing your baby. I just want to encourage you guys to try all methods that are available, all alternatives that are available to you before you go to formula. Formula is made of cow milk in it, vegetable oils to make up the the fatty oils that you would normally get in breast milk. It has synthetic DHA and ARA. It has sucrose, which is sugar. And they have to add the sugar to the formula because the sugar helps the baby's body digest that cow milk and digest that soy. So that is why they have to add the sucrose to the formulas. It also has the carrageenan in there, which is a thickening agent. I'm not going to go into that. But what's in breast milk, this is not what either one of these are limited to. I just brought out some main things that are in these components that are designed and formulated to be ingested by the baby. What's in breast milk? HMOs. Okay. HMOs, not very many people know about this. This is fairly a new research. This is a new thing that just came out through the research in studying the breast milk. Like I said, they're finding things every single day that the human milk, the human body is generating and making for. And this is amazing. HMOs. Have you ever heard of prebiotics and probiotics? I'm pretty sure you have. That's something that we need in our system now. I think one of the main reasons why all of us are putting these different types of prebiotics and probiotics in our bodies because we weren't breastfed by our mothers. Because HMO is exactly that. It's a prebiotic that the mother's milk makes Now, it has no nutritional benefit for the baby per se, as far as gaining weight or things like that. But what it is, it's a bacteria that the breast milk is creating. It can get set up in the intestinal structure of the baby. Okay? This is food for the good bacteria. Okay? This is vital to the baby developing and having a healthy gut, not only for their baby years, but for their adulthood. So a lot of us are struggling and dealing with gut issues now because, hey, we didn't get the HMOs from our mother's breast milk because mommy only breastfed us for 2 days, or mommy didn't breastfeed us at all. She gave us formula, which formula cannot make HMOs. Okay? So this is very vital for a healthy gut for a lifetime for the babies. Okay. This matures the baby's immune system responses. It also improves digestion, that a lot of babies experience. You know, now here lately, I've been hearing about a lot of children who have gas, like uncontrollable gas, colic issues, just really deep intestinal gas. But this will help. This will help with all of that. And the lack of this, I believe, is what links to colic issues with babies. You know, our body makes this a priority to produce. It takes a lot of energy to create the HMOs. Okay. And so the H stands for human, the M stands for milk, and then the O stands for oligosaccharides. Okay, that's OLIGASACCHARIDES. Oligosaccharides. And please go look it up. Go research it. Go see the benefits of it. I mean, it's amazing to me. I said, what? When I started reading up on this, like, because every year I'm looking to see like all of these different benefits of the breast milk, because breast milk, if my baby gets a cut, I put some breast milk on it. Red eye, itchy eye, put some breast milk on it. I mean, put breast milk on everything. It's amazing. It heals. It promotes healing. It's just amazing. It's amazing. And I hope this is encouraging to you guys, because like I said, when we know what things are made up of, when we know how it helps, when we know the benefits of it, 9 times out of 10, we are more likely to be a supporter of it. Okay. And so that's why I'm giving all of these different benefits. I'm bringing out these key points on breastfeeding, these key points on what's in your breast milk, so you can see, oh my gosh, my baby really needs this. I should really, instead of me breastfeeding for 3 months, I'm going to go 6 months. Instead of me going 6 months, I'm going to go 12 months. Instead of me going 12 months, I'm going to go till he's 2 years old. Instead of me going till he's 2 years old, I'm going to go till he's 3 years old. You know, I want that to encourage you to keep nursing. Keep nursing so that your baby can get everything that is required, everything that everything he needs to have a successful, healthy life. So like I said, your body makes HMOs a priority. It is a remarkable quantity of human milk. Okay? It's similar to the quantity of the total protein. The HMOs are prebiotic agents that selectively encourage the growth of beneficial probiotic organisms. Our immune system is in our gut, right? This is it right here. This is it right here. This is promoting a healthy immune system for your baby. I mean, this is amazing. It's amazing. I want you guys to go look it up. I'm still only on the HMOs. I can say more about it, but I'm going to let you guys go look it up, okay? Your breast milk has stem cells. Have you guys been seeing this new craze about starting a cord bank? Keep your baby's umbilical cord. For today, pay $300 and you can have your baby's umbilical cord frozen. And if anybody in the family gets sick because of the stem cells of the baby, you know, this will help fight whatever sickness or illness that you have, or this will help grow a new organ, or, you know, stem cells. Because they know breast milk has stem cells, just like the placenta has stem cells. But you know, they just recently found out that the breast milk has stem cells. And this is one of the main reasons why you have the influx of cancer patients purchasing breast milk. This is one of the main reasons right here. Stem cells. Stem cells have the ability to be released into the body, to go to whatever area of the body is damaged, and that cell turns into the cell that is needed for that area of the body. That is what a stem cell is. It's amazing. The father. Oh, let me see. What else benefits can I give you on those stem cells? Yep. Well, yeah, what else I got? The stem cells, T cells, and lymphocytes. So, the human milk actually contains a variety of all those cells, including macrophages. In early lactation, the breastfed infant may consume as many as 10 to the 10th power maternal leukocytes per day. That's a lot of leukocytes being consumed by the baby. And that's like the first initial days of nursing. Okay. So about 80% of the cells in early milk are breast milk macrophages. Okay. And like I said, you can look all of this stuff up. I mean, this has the capability to provide powerful protection against pathogens while at the same time stimulating the development of the infant's immune system. So this is important. This is all dealing with the immunological factors of the baby's system. Then you have your cytokines. I don't even know if I'm saying that right. Cytokine or cytokines. And chemokines. And, you know, what they do are they're multifunctional peptides. And the chemokines they're a special class of chemotactic cytokines. I don't even know if I'm saying that right. I don't know if I'm saying that word right. But what they do is they induce the movement of other cells. Okay. The cytokines, they can cross the intestinal barrier. And when they cross the intestinal barrier, what they're doing is they have the ability to communicate with the cells to influence the immune activity. So they're talking to the body, they're talking to the cells to cause the immune system to operate and function in the manner it was designed to operate in. Okay. They defend against infection. Okay. They defend against infection. And then they have the ability to enhance inflammation in the event that some type of injury happens. I mean, it just goes on and on and on and on and on about how it's so much stuff, so many benefits to this. So many benefits to this. Let's look at the calcitonin and the somatostatin. These words, I'll be trying to figure out how they come up with all these words. I'm like, I gotta say these words right because I just say C and S. But y'all not gonna know what I'm talking about. So I had to type it out and say calcitonin and somatostatin. I'm guessing that's how you say it. But the somatocin is it's not transferred through the intestinal wall, but the calcitonin and the somatostatin, they are growth regulating hormones. Okay. But they're delivered through the milk, and it protects from degradation and maintains bioactivity within the lumen. All right. They're still trying to figure out all of the different benefits of the somatostatin, but they know that they work well together in regulating growth in the baby. So, I mean, and you can find all of this information on you have your governmental websites, and I have the information as far as pediatricians and practitioners and things of that nature. They do have information for non-practitioners and the different proteins, the different nutrients, the different, let me move that out of the way, the different fatty acids and amino acids that's put into that is developed by the breast milk. I mean, they go into so much detail. So this information, you are able to get a hold of it. And it's so much. Last but not least, you got your insulin-like growth factor, or your IGF. And your IGF is your tissue growth. This is the protein that causes the tissue in the baby to grow. Okay. And all of this is found in human milk. Okay. So look into this, guys. Look into this. See how much of a benefit this is for you and baby. See the impact that you can have on your child's immune system. It's just amazing. I'm amazed. Single day, I'm amazed. There's just finding out something new every single day about the miraculous things that breast milk can do. All right. Here's a myth. Will breastfeeding destroy my supple breasts? I know women are like, I don't want my breasts to be all frumpy and saggy and wrinkly and, what other words you can come up with. And do your breasts sag after you've nursed? You're on your 5th child, and no. No, if you take care of your body, if you do everything you were doing before you had the baby, your breasts will not sag. But I tell you, your breasts will sag if you don't. If you let go of yourself, things happen. Your breasts are going to let go of your chest. So, I just want to bust the myth right now. Pregnancy can take a toll on the shape of your breasts, but breastfeeding does not make them wilt more. The lack of proper care and attention will. Okay. Your breasts are just like any other part of your body. If you neglect them, they will lose vitality. Okay. And of course, the older you get, the more attention you have to pay to vitality in your body, because you're getting older. There's certain hormones that stop producing. They just slow down. The older you get, it just slows down. So this is why it's all the more reason to make sure that what you're eating to live, and you're not living to eat. That way you're continually giving the body what it needs to continue to put out those hormones that are needed to keep the vitality not only in your skin, but in your muscles as well. Okay. So here's a couple of tips, and there's other things that you can do, but I just thought these were like the main tips that you could really focus on to making sure that your breasts continue to stay supple and firm. Stop smoking. If you're smoking, this right here is a number one killer, because smoking blocks the making of elastin. Okay, you need elastin. All right, so stop smoking. If you're smoking, just smoking alone can make you have saggy breasts. Even if you never breastfeed, even if you never do anything else to your breast, you never have children, smoking alone will cause your breast to sag. Okay, breast massage. There's tons of different techniques out there that you can use. They have different diagrams, pictures. I'm pretty sure somebody probably has a video out there, because YouTube has everything. So you won't be short of finding breast massage techniques that you can use. I would not be showing you any breast massage techniques because there's so much information out there for you to do that on. Well-balanced diet. That's number one. What you put in your body will come out. Okay, so make sure you're putting all the good stuff in there so that, the elastin fibers, the collagen fibers, that's all stays intact. Okay, exercise. Doing exercise like push-ups and hold on just a second. I was getting a phone call. Okay. All right. So you can do push-ups that will help develop the muscles around the breast. I think the chest press, any type of chest exercise that will help develop the muscles and the ligaments around the breast will help keep the breast firm. It will help lift them up if they are beginning to sag. Because remember, the breast is made full of fat, and then you have that muscle around it. So if you keep those muscles tightened up, toned up, it will hold up the fatty tissue. Your breast is made of fat, okay? That's all it is fat. Okay, proper moisture. Make sure you're properly moisturizing the breast area so that the skin doesn't begin to look wrinkled, okay? And try not to sleep on your stomach as much, okay? So those are just some key tips for making sure that your breasts remain supple and firm, even after pregnancy and nursing. Okay, keep your breasts moisturized. That is the number one thing, especially if you are nursing, because nursing can dry your breast out. I keep oil everywhere. I keep oil with me. So definitely, if you're nursing, make sure you have that oil with you. All right, proper latch on. And I believe this is my last slide. After this, I'm going to turn that slide off, and then I'm going to bring up my props so you can kind of see what it is that we kind of discussed, and give you like a real live example. So when I'm sitting here and I'm talking to sisters or someone who's about to have a baby and they really don't understand everything, I have props here now that I can kind of explain and walk them through. And so I just want to share these things with you so that you can see up close and personal what the breast looks like, how it's supposed to look like, what it's supposed to feel like, how you're supposed to latch baby properly on, how you're supposed to hold baby, things like that, how you're supposed to put the breast pump on. So I have these props right here, show you guys once we finish, and then I'm going to show you my son is, I don't even think he's in here, but he sleeps, so can't really use him. And I don't have a fake baby, so we're just going to have to pretend. Okay, so this is the proper latch of a baby to the nipple. The nipple should be completely in the baby's mouth. And the baby's mouth should be completely covering the areola. Unless you have like a really large areola gland. Because some women have really small areolas, and then some women, which I believe majority are women, the African American women, our areolas are a lot more bigger. The circumference area, the surface area covers a lot more. But every woman, you want the whole nipple in the baby's mouth. Okay, so just like this picture is showing you, the whole nipple of the mother is in the mouth. So as you see the baby suction, when the baby is suctioning, the milk, on the last diagram, it was called the lactiferous gland. You can see where it's kind of, I don't want to say inflamed, but it's kind of swollen. You see those three little, looks like little pockets. When the baby suctions, that's pushing the milk out. Okay, the milk is there. So when he sucks, it pushes those, and then the milk goes right into his mouth. And then that's when you hear that swallow sound. That's the sound you want to hear. That is how you know for sure that your baby is getting milk. If you don't hear that sound, then the baby's not getting any milk. Okay, so that's the sound that you want to look for. And you're going to get that sound when the baby's mouth is completely over the areola and the whole nipple is in the baby's mouth. Okay, so it should sound like he's just taking big gulps, and it should sound like liquid. It's just going down his throat. Okay, that's how you know baby's latched on properly. Okay, so I just put 3 little, like a little checklist, instructions on how to get baby on there. You're going to use the nipple to snuggle the baby's nose, which I'm like going to show you with my prop. You snuggle the baby's nose, and normally what happens is the baby's going to smell mommy's milk, and he's going to lift up his chin, mouth. Now, do not try to stuff your nipple in the baby's mouth. If his mouth is not wide open, you should not have to stuff your nipple in there. Okay? Snuggle his nose until his mouth opens completely, like he's about to yawn. And when he yawns and opens his mouth, you're going to guide from the bottom into his mouth, not the top. You're going to place it going down. So you're going to come from the nose, place the nipple from the bottom and the areola from the bottom, all in his mouth. And then immediately he's going to clamp down. Well, not clamp, but he's going to close his mouth down. And when he closes his mouth down, the whole nipple should be in there, and his mouth should be all over completely the areola. Okay? Now you're going to check to make sure the whole nipple is in there. Okay? If baby's not latched on properly, pain will happen. It will hurt when he sucks, because he'll just be sucking the nipple and he won't be getting any milk. Because if you're looking at the picture, the lactiferous gland is right at the back of the nipple, and that's what you need in the baby's mouth. So if he just has your nipple in there, all he has is just the duct, and he's not going to get any milk. Okay? So I lift this diagram up just for a little bit. So if you need to rewind it to look at exactly how it needs to look again, please feel free. Watch this as many times if you need to. Now what I'm going to do is I'm going to go ahead and I'm going to take my props out, and I'm going to put the video on me so you can see. And we're going to go from there. I guess this is the fun part. I guess I can talk about breast pumps, because some mothers will breast pump. I do breast pump. I pump almost immediately. We'll talk about how I do with my children. We'll talk about that. Yeah, we'll talk about it. Let me go ahead and get the camera on me so we can see what we got with the props. Oh, also let me say this. the benefits that breastfeeding does for a baby. I'm not sure if I told you any benefits for the baby. So let me just give you a few benefits that's for the baby. Okay. These are benefits. And this is research that shows that these benefits are happening for the baby. Okay. You have lower risks of asthma. The baby has lower risk of leukemia development during childhood. Obesity during childhood is lowered. Less ear infections. My children have, I don't think, my children have never had an ear infection, ever, ever, ever. And that is so common among babies. Okay. Um, is decreased significantly. Diarrhea and vomiting is decreased significantly. If my children ever get sick, it's because they done caught something. And it's just, hold on just a second. Let me open the door for my husband. Ugh. Honey? Hey, you better stop. Do you hear me? What you coming with this food? Honey. Huh? You don't come in, you not drunk. Put your hand down. Do you hear me? All right. Well, maybe he didn't want to come in. Okay. Okay, Father. All right. I'm sitting on the floor. Okay. Lower respiratory infections. Necrotizing. Enterocolitis. I had to say it like that. That's how they got it spelled. That is a disease that affects the gastrointestinal tract in premature babies or babies born before 37 weeks of pregnancy. Okay, so it drastically lowers the risk of developing that. And guess what else? Breastfeeding drastically lowers sudden infant death syndrome. Who would have ever known? So could you link sudden infant death syndrome to the lack of breastfeeding? Because I believe there was an era where it was like no women really breastfeeding. I think breastfeeding just here recently within the last 10 years has like resurfaced around. That's amazing, right? Because you have to do some co-sleeping with your baby to actually nurse them. And you remember back then they were telling you to take your baby out your bed and put them in the crib. And more babies that were laying in the crib were dying more often than babies that weren't laying in the crib. So take a look at that. It also significantly decreases the risk of developing type 2 diabetes. So those are the benefits for the baby that I wanted to make sure that I mentioned before I ended that slide. So, okay, now let's get to, I think that was it. Okay. All right. All right. Hopefully you guys saw that. I'm just now checking to see. Okay. Let me see. All right. I hope you guys were able to see the PowerPoint, or was I talking to myself? So please let me know if you were able to see it. If not, I'll put it back up. I was really hoping that you guys could see it. Okay. Let me check. I'm just trying to make sure that you guys are able, in fact, to see it. That's what I'm trying to check right now. Okay, so I have a question on here. Is there such thing as a mother eating so unhealthy that your breast milk is no longer beneficial to your baby? Yes. If you eat too much sugar or you're not eating a balanced meal, the breast milk begins to develop just more of a sugary content that's not beneficial to the baby. And what you'll actually start seeing is like this greenish poop. So anytime you see like a lime green poop or um, like a tinted green color, any green color that's letting you know that the baby is getting too much sugar. It's too much sugar in the milk. Okay. So you can produce poor quality milk if the baby is not getting milk that is a well balanced diet. So the different supplements and the different meals that I eat during pregnancy, you want to continue the same routine that you did during pregnancy while you're nursing. And you actually have to increase it by 500 more calories because baby's going to be taking a lot more from you because the development of the baby. Okay. So if you guys have any more questions, go ahead and type them in there because I've got the chat pulled up now where I can see. Can somebody tell me, were you able to see the PowerPoint? I'm not for certain if you guys were able to see it or not. I'll just wait for somebody to respond. Hold on just a second. Okay. Let me move this back. Okay, let me see. Let me reach here. Trying to plug up my computer. The battery's about to die. Okay. Sorry about that little pause there. Okay. Oh. Okay. Hallelujah. I just wanted to make sure you guys could see that. Okay. Now, let me turn the video on so you can see me. Oh. Okay. Okay, where is camera? Oh, okay. Shalom. All right, y'all should be able to see me now. Okay. So I wanted to show you guys that sun. Sorry if that sun is like blocking. Okay, maybe I have to stay right here so it doesn't get in the camera. Let me see. Let me turn the. Okay. Okay. Okay, so this is my prop that I have to show the sisters or the women what your breast looks like when you are lactating. Okay, this is what your breast actually looks like I don't know if you can really see, but it kind of has like little indentations on there where it doesn't look very smooth. But the indentations are representing the 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 milk glands that we saw on the diagram. If you remember the diagram that we had pulled up on there, showing you those little clusters that you saw, that's what the little, if you can see, I'm not sure if you can really see it, but this model is made to where it's to look like the lactating mother's breast. Okay, so if your breast looks like this, there's nothing wrong with you. Okay, this is just how your breast is going to look when you're full of milk or while you're nursing, and you'll actually be able to feel it too. It almost feels like little bitty fingers like tapping, and that's just the milk filling up. So this kind of has the indentations to show you what it looks like. And again, on the diagram that we had, you can see they represent the lobes, okay, the lobules, and they fill up with the milk. And on the diagram, remember I said this is the nipple. This right here is your nipple. This is not the nipple. Okay, that's not the nipple. I know that we've been taught that this whole thing is the nipple, but this is actually the nipple, and this around it is your areola. And then you have like these little, seems like little bumps on there. In the next video, I will go into detail what all those bumps help with. Okay, they actually make the baby's palate satiable. Like they're like, you know how you taste food and you're like, this releases certain hormones and flavors, and they do that. So that helps with the baby stay latched on. It's almost like traction being made right there too. So that's what those bumps are for. There's nothing going on with your breast. There's nothing wrong with your breast. If you think, oh no, I got these bumps on my nipple now or my areola and it just, my breast doesn't look the same. It's all the benefit for the baby. So it's okay. It's normal. Once you're done nursing, it will return back smooth. Okay, but that's your nipple. And this is your areola. Okay, this is what the side of your breast will look like when it's full of milk. If your breasts aren't that big, aren't this big, it's okay. It's just showing you exactly still what your breast is going to look like. Okay, so don't pay attention really to the size, but you want to pay attention to the rounding, and if you can actually see like the indentations, that's what you're trying to pay attention to. Okay. All right. So when you get baby latched on, you want baby's mouth here, all of this. So this is how it should be. All of this should be in baby's mouth. And when he sucks, it's going to cause those glands to push out the milk, and the nipple will expand into his mouth and the milk will come out. Okay. If baby only has this in your mouth, you're going to have a very uncomfortable experience. You want all of this in the baby's mouth. Okay. So I just want to show you what the inside kind of looks like. It looks just like the diagram, what the inside of the breast looks like. This is a lactating breast. So if you can remember from the diagram, you can remember. Can you tell me what the yellow is? The yellow is the fatty tissue. Okay. And the brown represents the lobules. This is where the milk is stored. The milk is stored in here. Okay? And these lines, those are the milk ducts. So the milk is created and formed in here, and then it comes out through the milk ducts. But guess what? It doesn't move until you put baby on there or you put a pump on there. The milk's not going to move without suction. Okay? You want to make sure that as soon as you start filling up with milk, you either get that baby attached to you or you get a breast pump, because you don't want to get engorged. You want to avoid all engorgement. It's very uncomfortable. And if you continue to wait to feed baby, you can develop an infection from engorgement. Okay? So we don't want that. But this is one of the props that I'll be using in my breast class. Yay! See that? That's what the lactating breast looks like. Now I'm going to show you what a non-lactating breast looks like. And I colored it. Yes, Crystal, breast milk is liquid gold. So this is what the non-lactating breast looks like. Okay? It's soft and there's no indentation. See how smooth that is? So this is your breast pre-pregnancy. Okay? There's no milk in there. Okay? This is the pre-breast. This is what it looks like. Okay? That's what it looks like from the side. Same thing. Baby, all of the nipple. This is the nipple. This is the areola. Okay? You want all of this in baby's mouth. So this is showing you a smaller nipple. Your nipple is this small. All of this should be in baby's mouth. Okay? All of that. Just like that. And what's going to happen is baby's going to suck and see how the nipple expands out. That's why I'm showing you this breast, so you can actually see the expanding out that should happen with your breast. So I'll do it again. All of baby's mouth is over your areola. Okay? And then baby's sucking. And see that? See how the nipple expands? That's what you want. But it's only going to happen if all of this, my fingers are representing the baby's mouth. All of this has to be in his mouth to get that effect. If it's not in his mouth, this is what's going to happen. Say baby's mouth is only covering this. This is what you're going to get. That looks like it hurts, doesn't it? It does. It will hurt. But this is what you get when baby's mouth is not all the way on there. And baby's not going to get any milk either. So all of this needs to be in his mouth. When he latches down, it's going to expand in his mouth. Just like that. Okay? So now I am going to just give you a couple of tips that I do when nursing my children. I've had all successful breastfeeding experiences with my children. And it's because I'm teachable. If you are teachable and you're willing to do things and try them until you get it right, you'll have successful experiences every single time too. You won't really have a good experience if someone can't teach you. If they can't help you, you won't, fare very well. So always have a teachable spirit, even though you may have 50 million children. I have 50 million children. And I'm always taking advice with nursing, with breastfeeding, with pregnancy, with whatever, because there's something that I probably didn't know. There's something probably that I don't know, and that another mom has done, and it was made it a whole lot easier for her. And I'm like, oh, well, I'm gonna try that next time. So if you have a teachable spirit, you can definitely learn how to nurse, and you can be successful at it. And then you can teach another mom, you know, what works for you. So I took the boob out. I know Crystal's like, yay, this is the part I've been waiting for. But this is the boob, and I'm going to use this as a demonstration because I have to be modest. And there are videos out there where women, they just have their breast out, and it's just, I just can't do it. I still have that, you know, shame that the scripture talks about, you know, just my Father. Okay. So, I'm going to use this boob and just, you know, like, here's the boob. Okay. Your boob is attached to you. I want to show you, I guess 2 different types. Well, these are different. Those 3 different types of nursing bras. Try to figure out, well, what is the perfect nursing bra? What do I use? What do I wear? Wear what makes you comfortable. Okay. Wear what makes you very comfortable. Wear what your husband says is okay for you to wear, especially outside of the house. I know at home I don't. You know, you're at home, you don't have to wear anything. But okay, here's a nursing bra. Oh, Father, I don't think I can fit this. Okay, here's a nursing bra. Uh-oh. Okay. Voila. And I'm going to put the boob in there. This is funny. Okay. So here's the boob. It's in the nursing bra. How you use this one. This one's kind of designed like a sports bra. So how you use this one is it just kind of pulls open to the side. Okay. Maybe I should put it down right here so it doesn't look like it's about to fall out. So you just pull this to the side, and then you have boob right there, and then you can have baby come latch around. My baby's out there, so I can't really show you how to put the baby on. And I don't think my husband will be okay with him latching on to a fake boob. So, but this is how you would use this type of nursing bra. But I can actually show you how to latch on your breast pump. Now, I thought this was really neat. I've never seen a breast pump like this before, but it looks like the closest thing to natural expression. And one of the sisters actually donated this. And so I was like, oh, I'm going to try this out. This is the name of it. Dulia. I don't know, but that's the box. And so I got this one, and I actually use it, and I really like it. It's like manual expression. I'm going to show you what it looks like. Show you what it looks like. Let me get it back out the bag. This is what it looks like. It's silicone, and this is how you use it. So what you would do is you would take the breast out, and you want to make sure, same way, you want the opening to cover the whole areola. So you see this opening to cover the whole areola. So I kind of do the same thing I do with the baby. I put the bottom in first, And then it is on there. And you get it latched on really good. And with this one, you're just, you see that? Can you see how the breast is moving? It's just manual expression. Just the squeezing of the pump. But you see how it's moving. And so I will be getting all the right amount of milk out of there. And this is easily adjustable because the way they made this is designed to fit pretty much almost every nipple. Oh, look at that. It's stuck on there. So I really like this breast pump. It's called the Dulia. I'm not sure if I'm saying that right. But like I said, it's a silicone breast pump. And one of the sisters actually donated this. And I said, I'm going to need that. So I grabbed it. And there's a mom on there showing you how to use it too. And she has a different type of nursing bra. But that's this nursing bra. So let's take that out. And let's do the other nursing bra. And then it has a little top for you. Like if you get full with milk, it has like this little path that guides the milk out where you can just pour it into the bottle. But if not, you just put this top on there. If you got milk in there and get knocked over, it's safe because it has a top on there. But I really like it. I liked it. It was very soft. It wasn't uncomfortable when I was using it to pump. I thought it was really, I was like, man, why am I just now hearing about this? Okay, so let's try another nursing bra. Some women may not know how to use the nursing bra, so I just figured, oh, well, let's do that too. Okay, here's another one. How does this work? So I guess this one is kind of like a regular bra. I'm not a fan of bras. I'm just not. But this is like a regular bra. And I'm pretty sure you guys know how to put bras on. Just put the latches in the back. All right, let's put that on. This is funny. Okay. Okay. All right, put the boob back in. Oh, jeez. Okay, so the boob is in there. And how you use this type of bra, there's like little hooks here that they have. And these are pretty good. Oh, excuse me. I've had a couple of nursing bras with this little latch thing. I really like it. I like these a lot better than the sports bra type because it's constricting. It's like takes the breath out of me sometimes. So I really do like the ones that have the latches. I was trying to find the camisole. I have a camisole, and I like that over the actual bras because the camisole still has this latch and you could just pull it down instead of actually putting this on like a regular bra. But you just take the latch and it clicks and it comes down. And you have like this outer portion of the bra that holds the breast still intact. And so same thing. You can bring baby across to nurse them. Same thing with the pump. You could just learn to nurse it. And then you just, when you finish, you can just put the hook back on there. And then that's how that one works too. So take that one out. And then there is one more type of bra, nursing bra. that is used. And this one is like a mix in between a sports bra and just a regular bra. And it has the same thing. It latches. It has a little pull down latch. Same thing with the little barrier to hold your breast in still. So this one's comfortable, especially like if I'm working out. This is the one I use when I'm working out. So that's another one. Use a nursing pillow. This is a nursing pillow that I have. One of the sisters got this for me my last pregnancy, and this is by far the best pillow ever. It's like memory foam, and it has notches. If you can see that, it has like little notches on each side. So no matter what side that I'm nursing baby on, it kind of holds his head up. So the name of this pillow is My Breast Friend. So it's BREST. Friend. I'll show you what it looks like. My Breast Friend. And this is so comfortable. It helps with your support and your posture too. So this is how you put it on. And it snaps. I know the nursing pillow that's most likely purchased is the Boppy. But this is better than the Boppy pillow. But this is what it looks like. And you can adjust it to fit you. It has the adjusted strap. And also has like a little pocket if you're going to, whatever you want to put in there. And see, it's like almost a tire. It just stays on there. And so you can get baby, if you're going to nurse baby from this side. He has a little pillow cushion on this side. Or you're going to nurse him on this side. He has a pillow cushion on this side. You can actually sit up straight in the bed with this type of pillow. So I really like this pillow. You want to remember to relax. Don't get anxious, because when you get anxious, that can stop the milk flow. Getting anxious or trying to rush or being frustrated or being in you like a stressed out moment, that will cause your milk to decrease. It'll stop. It won't come out. So if you know you need to nurse baby, even if you just nurse the baby, have any milk? No, don't say that. Okay. Just stay calm and just breathe and relax. When you relax, the milk will flow freely. Okay. What I normally do when nursing, every time that my children eat, I eat. And that's how I keep up on the calorie intake. Because you're burning 300 calories, between 200 to 300 calories every time your baby nurses. So when my children were ready to eat, I'm like, okay, let me grab a sandwich. Let me get like some cranberry pomegranate juice. Then that I have to force myself to drink juice because I'm not a fruit. I don't really like fruit. So I'll get my juice, I'll get my sandwich, and I'll get a snack. I like some celery, some cheese, and crackers with the sandwich, because you have to eat more, like 500 calories more nursing than you do with the 300 calories more being pregnant. So I would be eating while they're eating, and I would keep my fluid intake up. Drink lots of water. I know in the hospital they give you like this 32-ounce cup. Get you a gallon jug and drink. You want to be drinking that water all day long. Keep that water flowing all day long. It's perfectly fine. Every time your baby is trying to nurse, you eat. You eat. That way you're keeping up on whatever is going out. For engorgement, you want to drink pineapple juice. Pineapple juice will help with the flow. It will help with the releasing of the breast milk coming out. It will help leak all of that out so that you're not getting knots and just engorged all up under your underarms and armpits. And you want to drink pineapple juice, and you want to self-express. If you have too much milk, it's hard for the baby to latch on. You want to learn how to self-express. And let me show you. So with self-expression, you're going to mimic what the breast pump does. Okay, so in self-expression, let me see if I can get this close. Okay, so say I'm engorged. Self-expression, what you're going to do is you're going to take your hand and you're going to mimic baby. You're going to push. So push with both fingers and kind of expand out while you're pushing. You're going to push and then come down. Okay, so you're going to put your hand, but you're going to use your whole hand. It's not my boob, so I'm like trying to hold it, and then so my whole hand is not on there completely, but you're going to take that whole hand and you're going to push back and up, opposite direction. You want the fingers to go the opposite direction. So you're going to push back and down and then come down just like that. Okay, and then you're going to keep doing it, and then you're going to have milk come out. And it's just going to keep coming out. And you're going to keep doing that until that pressure releases. Okay. Your milk may squirt out and it may just leak out. But you're going to keep doing it. It may be uncomfortable, but you're going to keep push back and down and then come down. Push towards your chest and come down. Push, come down. Okay. That's how you manually express your milk. So if you're dealing with engorgement, that's what you want to do. You want to manually express your milk until you got some release where baby can actually get a good suction on there. Because if he can't get a good suction on there, he's going to get frustrated, or she's going to get frustrated. You're going to get frustrated. You're going to be in some discomfort because you can't get baby on there, and then you feel like you got to push his face in your breast. And so self-expression first, and then get him latched on there. And drink your pineapple juice. Drink your pineapple juice. That will help it come down. Okay, that will help them let down. Rehydrate. If you get dehydrated, rehydrate with coconut water. I'm always going to say coconut water because that is the fastest way to get rehydrated. It has more potassium in it than a banana does. Okay, and you need potassium and magnesium to actually be rehydrated. Water alone is not going to rehydrate you. Okay, you need those minerals. You need those vitamins in there that helps build hydration in your system. Okay, you need those electrolytes. Okay, water does not have all of that by itself. Okay, although water is good because, of course, 72% of your body is water. So that's why you want to keep water in your system. But for rehydration purposes, I'm always going to recommend coconut water. Okay. Use that breastfeeding time as a bonding moment for you. You know, you just sit down and you just get to relax and enjoy your baby. Talk to your baby, sing to your baby, read to your baby. I'm always reading to my children, singing to my children. Sometimes I just stare at them. I'm just like, wow, you were in there for 9 months and you're here. Hallelujah. I don't know. I'm just staring at them all the time. So use that as a bonding time. Okay. And we went over the nipple should touch baby's nose. So what you wanted to do is say my finger's baby's nose. Say this finger is baby's nose and these fingers are baby's mouth. You want to bring your nipple up and you want to touch his nose. And as you're touching his nose, guess what? He's going to smell mommy's milk. And he's going to open his mouth. As soon as he opens his mouth, you're going to lead the bottom. Lead the bottom of your nipple in first. And his mouth is going to come down. And then boom, there you go. And see how it's expanding? Because baby's mouth is on there properly. Okay, so you're going to touch his nose with the nipple. And he's going to smell your milk, and he's going to open his mouth, and you're going to lead in through the bottom, and he's going to clamp down. There we go. We got proper suction going on. Okay. You have sore nipples. Put your breast milk on it. That's the best thing you could do. Put your breast milk on your nipples. Put that breast milk on there, and then if you have some nipple cream, you could add that nipple cream on top of it, and you will see how quickly that your nipples will heal from your breast milk being put on there. Okay. Use natural oils. Okay. Coconut oil is really good. Avocado oil is really good. Okay. I don't really recommend lanolin, but if that's the only thing that you do have, use it. Okay. Most nipple creams that they have out there now are made of coconut oil and sunflower oil. My nipple cream is made with those ingredients in there, so it's perfectly safe for baby. But try to express your breast milk and rub your breast milk on there first, and then add the cream to there. And you will see dramatic results with the healing of your nipples quickly. Okay. I think that is about it as far as my demonstration on pregnancy, on the nursing. Let me look at these. I got some more questions, I guess. Okay. Could you tell us what oils, herbs, teas, and tinctures you take while nursing that help with more milk production, especially new mommies? Yes, ma'am, I definitely can. I actually have developed a tea that comes in the kit, the postpartum and nursing kit, one of those kits that comes in there. But red clover herb is really good for milk production. Fennel is great for milk production. You have fenugreek is very good for milk production. Red raspberry leaf is really good for milk production. Let me see. You have the nutritional yeast that helps a lot with your milk production. There's so many different, let me see. I've got a lot of this stuff written down. And eating a well diet is the best method of increasing your milk production. Even though you're adding in these different teas, different tinctures, you want to make sure that you're adding it on top of a good diet, a good eating lifestyle. You want to be eating from all food groups. You want your meat. You want your, or if you don't eat meat very often, like I really don't eat meat very often, you want to make sure that you're getting the proper amino acids in to help produce the proper milk flow, which amino acids, the amino chains, protein. That's what they call protein. You want the proper amount of protein in there, and you can get that from different herbs. You can get that from different plants. You can get it from legumes. You can get it from your nuts. I eat a lot of walnuts. I eat a lot of pecans. I eat a lot of almonds. So I get my protein sources from different areas. You want to make sure that you're getting like your seeds in, like your flaxseed helps with milk production. Your hemp seed helps with milk production. Cinnamon helps with milk production. I create a lactation oats that I eat every morning. And I kind of gave you guys idea of what it is that I do for my breakfasts. A lot of my oats, everything that I eat, my cereals, is power packed with super grains, super fruits that will help with milk production. So I guess I will have to do just a video on milk production to actually give you all of the different herbs and oils that you can use to help with the milk production. There are tinctures out there. They have a tincture called the mother milk tincture. I can't remember the name of it, but they do have that. I've developed my own tincture that will help with the lactation off of herbs that really aren't your mainstream herbs. So they have cookies now. They have like a little bar. I tried one of the fenugreek bars and it really did help. It's by Patel, but you have to order it online. I can't even remember the whole name, but they were really good. They were really good. Nursing bars, milk production lactating bars. I think that's what they're called, lactating bars. Okay. What else do I have? What's your opinion about alcohol consumption while nursing? Well, to be honest, I haven't really done much study on alcohol consumption during nursing. And I would actually have to go and do some research on that to actually give you information regarding that, you know, statistic wise. But for me personally, I don't drink alcohol. So that's not something that I've had to have, you know, I've had to be concerned with. But I would overall just, I'll look it up. I'll do some research on it and see the pros and cons of consuming alcohol. More than likely, they would probably recommend you to do the wine instead of doing any type of hard liquor. If you must consume alcohol, I'm pretty sure that they would probably recommend wine over anything, and it would probably be limited. So to be honest, I really don't know anything about the alcohol consumption during nursing, but I will look into that. That's a good question. I never even thought about that. Okay. What else? What causes the letdown in the breast during feeding? Relaxation. You have to relax. Okay. Most women don't get let down because they're tense. You have to be tense. You have to be tense. You have to be relaxed. Breathe and think about your milk flowing. If I know that's strange, but it's almost the same mentality we have about when you think better, you are better. So it's the same thing. If you think, okay, my milk is coming, it's flowing, it's coming, it's gonna flow. But if you're frustrated, if your mind is congested, you're anxious, you're stressing out, you're gonna have a hard time having the letdown. So I find that when you take a deep breath, you get yourself back grounded. I don't know if you guys watched my last video, but I talked about grounding yourself. That helps a great deal with boosting the immune system. It does the same thing for the letdown of your breast milk. Grounding yourself, taking a couple of deep breaths, getting yourself back in tune with your body, knowing that this is what your body is supposed to do. Deep breath. You'll notice that the milk just begins to flow and let down. Okay, tell your breast what to do and it will come down. Okay. On the video you did about when labor starts in terms of doing a lotus birth, could you share more details about your setup? My husband and I are doing one and want to really get a depth insight. Okay. So my setup for the lotus birth. Um okay, so I have the basins. I have multiple basins. So that way when one basin is being used with cleansing, I have a fresh one to put it in. And I have about 3 or 4 basins that are just set aside just for the lotus birth. So my preparation for that is I make sure that I have at least a pound of herbs, because I know for certain that the placenta is going to be attached to our baby for maybe 2 to 3 days. That's the longest time that we've had the placenta actually stay attached to me and the baby. So I have like a pound of herbs already set aside, and the herbs that I use are the most strong. So what I mean by the most strong in scent: petals, your geranium, your lavender, rosemary, those nice, good, strong scents mixed together. I put all of those on the list for the lotus birth, for covering the placenta. So what happens is after baby's born, the placenta gets cleaned with a mixture of water and tea tree oil. And like I said, we check the placenta, making sure that all pieces are intact. There's no missing pieces. And we are washing it off, getting all debris, as much debris as we can off of there. It will shrink day by day. So you want to make sure that the cloth that I showed you, that was just the first cloth. There's actually about 4 or 5 cloths that come in a set for the placenta. So every time you wash the placenta, you're going to put it in a different linen cloth with a different set of herbs. And so each basin is for cleaning and then setting the placenta in there. So you want to make sure you have your cloths. You want to make sure you have your water and your tea tree oil already mixed up and set aside. You want to make sure that you have your pound of herbs. And you can pick what herbs that you want. You want herbs that the smell you really don't, that the smell doesn't bother you. Okay. So I like the smell of lavender. I like the smell of geranium. I love the smell of roses. So I mix all of those together. That way it creates, a perfumey scent, because the placenta will give off a scent because it's decaying flesh. Okay. It's slowly decaying and shrinking, and it's blood. So blood has a smell, but the herbs are to keep down the smell. And you want to make sure you have enough herbs. Without enough herbs, you'll kind of smell the smell, and it just smells like blood, dried up, blood. That's what it smells like. Your husband may not like this smell. He may not be used to that smell. So the herbs and stuff is really for your husband when he comes in or whatnot. So he's not smelling that bloody smell. Women may be typically probably used to smelling what blood smells like. But men are not. So the herbs are really kind of to help them be able to better cope with a bowl of decaying flesh. So that is the setup. And now for disposal of the placenta, once the cord is detached from the baby, here we burn our placentas. Other places, they bury theirs. They bury it and they grow a tree on top of it. We burn ours. And I do that for spiritual purposes, to protect against anybody trying to, manipulate or know where a part of my baby is, because that placenta is attached to his life. I just burn it. And just to ward off any, for people who are spiritually aware and who are of the faith, who can understand what I'm saying, it just blocks off the attack of the enemy on any portion of what belongs to the child. So we burn ours. And so preparation for burning the placenta, we have a tin can And you can put in the tin can, set it on fire, and boom, it's ashes. And then you can dispose of your ashes any which manner you please. But that is normally the setup as far as lotus birth goes. And we make sure that we continue to cleanse the cord with I use myrrh and water and a little bit of glycerin, and I just spray the cord to make sure that it stays clean, because you want to keep down all any type of germs can start building up, okay, because it's decaying flesh. So you just want to make sure that it stays clean. It stays clean as it's shrinking. So the myrrh and water, just like a little spray bottle, you can spray that on there to cleanse it off every day, and you'll notice that it's shrinking and it's drying out. You want to keep that place aired. You want air to be able to flow. If air is not flowing, that's going to develop the smell even the more so. So you want air to be able to flow through there, not only through the placenta, which is why we recommend the linen cloth, but you want to make sure that the cord is out and open too. So if you're going to wrap baby up, don't wrap that cord up. Don't wrap it up too cozy and too the baby most of the time is going to be fine. He may not even have to be wrapped up. My son didn't have to be wrapped up until maybe nighttime when it did cool off. But you want air flowing constantly, bad bacteria and germs. Let me see. What else about the lotus birth? I'm trying to think what else. I'm trying to make sure I make mention of everything with the lotus birth. Okay. I made mention of the herbs. Oh, and you want to make sure you're being very careful. Wherever baby is going, that bowl is going to have to go with them. So just move carefully. The good thing also about the lotus birth is not very many people are going to want to hold the baby because they're like, what? I got to hold this bowl of what is this? So that's a plus. If you're not really wanting to hand off your baby, if you kind of are shy with asking people to respect your opinion or your personal choice not to hold the baby. So that's a plus for people as well. My husband makes it known when we have our children, we don't allow people to hold them because we know how sensitive that time is with them, and we know how precious and fragile their system, their whole body is right now. So it's already known before the baby comes that nobody will really be holding them up to like a 6-month period. So that's another plus. The bowl, the placenta in the bowl, people are like, I'll just wait until that falls off. So hopefully I answered your question on the lotus birth. I'll probably do a video on just the lotus birth too, to make sure I'm getting everything on there. Hello, I wasn't breastfed, and I think that's why my immunological system is low. What do you think of that? Well, I think a lot of us weren't breastfed, and we just have to make up for, what we missed out on. Because breast milk is full of so many different nutrients and components that our body needs, that's just something that we missed out from our mom. And the best way we can make it up is by, eating properly, eating a well balanced diet, eating more alkaline than acidic, making sure that you're getting your prebiotics in there. If you can get prebiotics in your system to where it can develop the probiotics that need to be in your intestinal tract, I think that will help out exponentially, because our health is in our gut. So if you can get those prebiotics in your system, you're interested in purchasing somebody's breast milk, whoever's selling it, I mean, you know, that's the only thing that I can offer. The only thing I can suggest in that, I think a lot of our generation missed out on the breastfeeding. And it just because, like I said earlier in the video, it's just a lack of education to our people, to people in general. We weren't this technologically sound. We didn't have all this information out back then. And, all of these things are coming out now. So take advantage of the raw food sources that we have access to build up our system, build up where we have lost, build up where we have messed up, build up where our parents weren't really educated on. And, if purchasing breast milk is not a problem for you, purchase some breast milk from, somebody you can trust. So that was a good question, because I was breastfed, but I wasn't breastfed very long. And, I believe a lot of the health issues that I had early on in life was due to that. And it was just a lack of understanding and a lack of education on my mother's part. So just using this education now that I have to make sure that my children have exactly what they need, so that their immune system, their body is equipped for a lifetime. So, yes, sir. Can you discuss the different positions in which the baby can be held during feeding, and which one works best for you? There are so many positions. um, um, I don't have the baby. I would like to show, I'll do a video with positions, just showing positions of holding the baby when I actually have my son in here with me, or I have the new baby that just was, the new fresh baby that we have. I'll use him, and then he's probably gonna be wanting a nurse. It's gonna be funny, but I'll use him. I'll do a video. But my favorite position is the across. The baby being across my chest area. I really like that position because it's I think it's called the cradle. So it's like I'm cradling the baby. It's the best position for me because I have like straight eye contact with them. I'm able to look at them, and I'm able to see proper latch on, and it's easier for me to get them unlatched. Oh, which I wanted to show you guys how to get a baby unlatched. So I can't really show you, but if we're ever in a room personally together, I could show you. But what you do is, if the baby is on wrong, or the baby is on and you have to go, I teach my children at a very early age to let go. Okay. So a lot of it is just reinforcement, continuous repetition, reinforcement. If the baby is latched on wrong, what you're going to do is you're going to take your finger like this, your knuckle, and say the baby's on. The baby's on there. So I'm on my mom. Say I'm on my mom. I'm on her nipple. And you're going to take, so say this is the nipple. I'm on her nipple. You're going to take the corner of your finger and you're going to go to the corner of their mouth. And when you do that, you're going to push, and it's going to be uncomfortable. It's not going to hurt them. It's just going to be uncomfortable, but it's going to cause them to go, and it's going to immediately release suction. And they're going to, as soon as that mouth opens and that suction releases, you can pull your nipple out. So you're going to take the corner of your finger, and you're just going to push the inside, the corner of their mouth, get to the corner of their mouth where their mouth begins to open. They're going to be like, what is that? And they're going to go. They're going to immediately release. And so you can hurry up and get your nipple out, and then try again with getting them latched on if you have to go. What I normally do with my children, I start from like day one. And I just talk to them. I'm like, okay, okay, let's go. Let go. I let go. And I use this method. I just do that a little bit. And I say, let go. Okay. Or let's go. And over time, I don't have to do this anymore. Go. Like now I can latch my son on and my husband's like, okay, honey, we have to go right now. I'm like, oh, okay. And I'm just say, hey, son, all right, we have to go. Let's go. Let's go with daddy. And he'll look up and he just goes, he lets go. So you can start very young because children, they respond. They respond to reinforcement. Okay. It's just conditioning. You do positive reinforcement with them. Take a motion and they'll identify that motion with that word. So if I'm saying, okay, let's go, and it's with this motion, they automatically know that when they feel that sensation, that means let go. And then when they hear let go, they know, oh, let go. So you no longer have to do this. You just have to say, hey, let go, or let's go. And so I start baby when they're so small because they pick up off of reinforcement. They pick up off of repetition. And so those are the two ways that you can get your baby to let go whenever you need them to, or if they're latched on improperly. Okay. And a lot of this stuff I can do hands-on with you to just kind of show you, because there's only so much that you can actually learn from a video. There's only so much that you can actually learn from reading or somebody telling you something. A lot of us learn from hands-on or actually being put in that position to do it. And so hopefully for people who don't know me and it's not close to me or you're not in my vicinity, hopefully that this video is beneficial and helpful enough. But for those of you who do have access to me, just let me know, hey, can we go over what you talked about in the video? Can you show me how you actually do it? Yes, I can help you with that. Okay. I wish I knew that 2 years ago for future references. I'm so grateful for this. Hallelujah, sis. Bless you. Well, if I don't have any more questions, I'm gonna go ahead and end this. And you guys, if you come up with any more questions, you could just type them in. You can email me. You can go to the Facebook page. You can email me, chat, whatever, and just get that information to me, and I will do another video, or I'll email you or send you answers to your questions. And I hope this video was very beneficial to you. Bless you guys. Thank you for watching, and share this to somebody who you may know is about to embark upon breastfeeding or is having difficulties breastfeeding, or just is interested in learning more information. So bless y'all. Shalom.